Story 1. I'm a dentist, not a physician. I had an assistant years ago whose daughter kept breaking out in ulcers in her genital region. She was 3 years old at the time. Doctors kept accusing the mother of exposing her daughter to sexual predators and had Child Protective Services investigate multiple times. The mother would break down in tears at the office, completely exhausted and hopeless, thinking her daughter was going to be removed from her care. All she wanted were answers. She shared her doctor's findings with me. I told her the symptoms were consistent with Behçet's disease. She went back to her daughter's doctors and asked them to evaluate for this. They refused, saying she was too young to exhibit symptoms of Behçet's disease. She finally found someone to listen to her, and the child was diagnosed. It was one of the youngest cases of pediatric Behçet's disease. Story 2. Not a doctor, but a little while ago I had pain that I couldn't pinpoint the origin of. It felt like really bad acid reflux and back pain, and it went around the whole torso in the diaphragm area. One day I was doing sit-ups and felt like there was a golf ball moving under my ribs, so I went to the doctor. She examined me and didn't find anything unusual, so she told me to see a physiotherapist since I only felt it during movement. The physiotherapist examined me and didn't find anything either. Instead of wasting the appointment, he had me lie on my stomach with a pillow under my abdomen while he worked on my upper back. I put my hands under my stomach to keep them from hanging down, and when I was told to take a deep breath, I could feel a lump pushing down from under my ribs. I asked him to feel it, and he was stumped as to what it could be, so he sent me back to the doctor. It turned out I had so many gallstones that my gallbladder could be felt through the skin when I took a deep breath. I was sent to the hospital and had an operation on a Friday night. They counted 21 stones. The largest one measured 1.2 centimeters. The gallbladder was stretched so thin and swollen that it ruptured while they were trying to remove it. All the doctors in the hospital asked to feel it prior to surgery because no one had heard of it being possible to feel a gallbladder through the abdomen, so I guess it was rare. Apparently, I should have been in excruciating pain, but I was just taking ibuprofen and trying to do stretches for my back the whole time. Story 3. I was 15 and a cheerleader and woke up feeling kind of off but nothing terrible. I got through the day with mild random symptoms like feeling slightly woozy and a distinct lack of appetite, which was unusual but welcome because I was always hungry. I didn't think much of it, even when my muscles, especially in my legs, started feeling stiff. All the more reason to work out, right? By the time after-school practice came around, I had a little trouble breathing, but it was hot since I was in Florida, so I didn't think much of it. I was a flanker at this point, so nothing too strenuous, and I pressed on. During a kick drill, I got a headache. It was hot, so I dismissed it. Then I had a nosebleed, but it wasn't a simple bleed. It felt like a fire hose of blood spraying out everywhere, and it would not stop. It also looked a little strange and bright. After 15 minutes of ice packs and pressure with no end in sight, the coach called an ambulance. At the hospital, they cauterized a blood vessel in my nose, which smelled unpleasant, and ran some tests. It turned out I had simultaneously the lowest iron and the highest copper levels they had ever seen, and they were baffled. My mother arrived and was questioned about potential chemical exposure and environmental hazards. They admitted me and started chelation therapy. They considered a diagnosis of Wilson's disease, but it didn't quite fit. Several doctors disagreed on this. They gave me very large iron pills and put me on intravenous vitamins. My stool was a very strange color, which concerned them. They kept me for weeks. My copper levels dipped after chelation therapy but then started climbing again. No one knew what to do. Someone suggested bloodletting, hoping my body would produce better blood to replace it. They tried this, but it didn't help. Eventually, they released me from the hospital. My bright blue eyes had a copper halo. I had to take many iron pills and have frequent visits to monitor my blood, with random chelation therapy and other treatments along the way. This continued for years, and I learned to live with it. I was on a special diet to limit copper intake, couldn't take multivitamins, but had to take many other supplements. If I forgot my iron pills, my symptoms worsened quickly. My case was written up in a few medical journals. Fast forward to just before I turned 28. I had headaches and a strange cough. I was misdiagnosed with a sinus infection, migraines, and eye strain. I was put on antibiotics, nasal spray, and given glasses I didn't really need but wore anyway. Then a doctor found a strange lump in my neck, a thumb-sized tumor pressing on my carotid artery. I was fast-tracked to surgery because of the location. It was cancer. They removed my thyroid and, underneath it, found a very unusual parathyroid gland. It was huge and somewhat green. They removed that as well just to be safe. Because of my complicated conditions, they kept me a few extra days to monitor me and consult with my primary care physician. My copper and iron levels normalized almost overnight. The iris rings faded and disappeared completely. They reduced my iron pills and then eliminated them entirely. For the first time in over 15 years, I felt normal. The muscle spasms were gone, as was the stiffness, frequent cramps, eye twitches, strange stool color, and constant low-grade nausea. It turned out a mutated parathyroid gland was responsible the whole time. Story 4. Not a doctor, but the patient was my dad. He had been having sinus infections that would not go away for about 3 months. Symptoms included sinus pressure, headache, eye pain, runny nose, and cough. He was given a steroid, and his symptoms would improve for 3 to 7 days, but then they would return. All lab results were normal. He went to the dentist, a longtime family friend, for a regular cleaning and checkup with typical x-rays. After the x-rays, he did not see a staff member for at least 20 minutes, which made him suspect something was wrong. The dentist came in, showed his x-ray, and explained that my dad had a large tumor. The mass sat between his hard palate and sinus cavity and looked like an octopus with arms, wrapped around some of his jaw and the roots of his teeth. Imagine our shock when he came home and showed us the x-ray after a routine dental cleaning. He had surgery to remove the tumor. He lost part of his palate, all but 2 of the top row of teeth, and part of his jaw, but the entire tumor was removed. The tumor was benign, but the surgeons did not want to risk leaving any of it behind to avoid regrowth. It took about 3 months before he could get impressions made for dentures. These dentures were a large contraption with a piece to fit the hole in his palate, extra support due to the lack of jaw, and the typical teeth. It took an additional 1 to 2 years to get them to fit properly, especially for eating and drinking, because he had a hole from his palate to his sinus cavity. If the dentures did not fit correctly, food or liquid would slip through and come out of his nose. Not a fun experience. Now, more than 10 years later, you would never know anything like that happened to him unless you are at our house late at night when he takes out his dentures. Then his request to turn off the lights might sound distorted. It is amazing how things aligned. We are thankful the dentist caught it when he did. We are thankful it was not cancerous, especially since my dad had thyroid cancer a few years earlier. We are grateful the dentist knew of a surgeon in our area willing to perform the surgery and that it was done well. We are also thankful that the surgeon knew of a specialist who could make the customized dentures and mouth prosthesis. The maker was one of 15 people in the United States who could create something like that. We are thankful my dad persevered, especially going from eating sandwiches, salads, steak, and crunchy foods to eating pureed food for 4 months, then gradually working his way up after getting the dentures. It took about 1.5 years before he could bite into a sandwich without pain or having his denture slip or fall out. Story 5. I am one of those cases. I had a hysterectomy, and 7 weeks later, a random artery burst open through my newly sewn vagina. I had started spotting out of nowhere, and my obstetrician gynecologist just happened to be in the office that day, so she told me to come in. As soon as I got to the office, the spotting turned into gushing and pumping. I lost 2 liters of blood on the office floor. She put me on the table and looked inside. She said she had never encountered this before. She could see the artery pumping blood out with every heartbeat. She performed emergency surgery right there without any medication. She saved my life, stopped the bleeding, and sent me to the hospital for medication. I had a parade of doctors coming in the next 2 days, looking inside me, wondering how an artery burst through my wall. Estimated time of arrival. My boyfriend was in the waiting room and heard the whole thing. He was certain I was going to die. This happened during a difficult time in my life, so thankfully I was already in trauma therapy. I definitely needed it after this experience. For those women who just had a hysterectomy and now have a new fear, I am sorry. This situation was not normal. Even with the complication, I do not regret getting it done. Story 6. I am not a doctor. My dad was the patient. He had stage 4 non-small cell lung adenocarcinoma. We knew he had a short time, 5-year survival is about 10%, but he had bladder cancer in the past and also post-polio syndrome, so it was probably a couple of years at best. He wanted treatment while there was some hope it would work a bit. He and my mum had just bought a house in New Zealand, and he wanted to live there and enjoy the scenery for a while before he died. So he started chemotherapy. He got the usual chemotherapy side effects, one of which is an itchy rash. The chemotherapy rash was one of the things they warn you about, so it did not bother him too much. He just put cream on it and did not complain. Then my brother visited. He is training to be an emergency medical technician, so he had some basic medical training. He looked at the rash and said, "Dad, please come to the hospital with me." This was in 2022, so Dad would have been in the hospital by himself due to COVID-19 limiting visitors, and he really did not want to go. But my brother insisted over and over, and eventually Dad gave in just to get my brother off his case. It turned out it was not just a chemotherapy rash. It was the start of a rare disease called Stevens-Johnson syndrome, which in rarer cases can be brought on by allergic reactions. It is even rarer for it to be brought on by an allergy to chemotherapy drugs. He lived in the Burns ward for about a month while my mum was packing up the old house. Due to his prognosis, they let us all visit every day despite COVID-19 restrictions. So yes, my dad was allergic to chemotherapy. He lasted another 2 months after the onset of Stevens-Johnson syndrome. I miss him every day. He did get to live in the New Zealand house for 3 weeks. He probably should not have flown with his lungs in such a bad condition. Flying was a bad idea, but he was determined to live in that house if it was the last thing he did, and it was. We were all there with him when he died. Story 7. I am not a doctor, but I work in an emergency room and trauma center doing patient registration, which puts me up close and personal with many difficult situations. A patient came in with a frozen leg. They were upset that their doctor would not amputate a perfectly healthy leg. So they submerged their entire right leg in dry ice for nearly 7 hours to force the medical team to remove it. The leg was so solid it made a noise when the doctor knocked on it. I cannot imagine the pain this person endured in order to get the leg amputated. It was a case of a rare mental condition in which the brain rejects the idea that body parts belong to oneself. Nobody at the hospital where I work had ever seen a case like this before. Story 8. My ear, nose, and throat doctor walked into the room on my first appointment and told me I had the weirdest computed tomography scan he had ever seen. Does that count? My sinus cavity is approximately 85% fungus. He was genuinely surprised I could even breathe through my nose. The computed tomography scan is kind of horrifying. He thinks it has been like that since I had jaw surgery 15 years ago. Once I have surgery to clean it out, I am probably going to overdose on oxygen. Story 9. A child came in still unable to walk at 3 years old with unusual eye-rolling movements that appeared to be seizures, but had a normal electroencephalogram. This condition is called oculogeric crisis, where the eyeballs remain fixed in an upward position. Genetic testing revealed a rare defect in the enzymes responsible for producing dopamine and serotonin. We use levodopa, the final precursor to dopamine, in patients with Parkinson's disease. Her defect was in an earlier step of the process, and the enzyme for the last step was functioning properly. We treated her with levodopa and 5-hydroxytryptophan, the final precursor to serotonin. 6 months later, she was able to run. She will need to stay on medication for life, but the treatment unlocked her body's potential. Story 10. Not a doctor, but my cousin's baby is one of only about 25 recorded cases of having a fully developed third nostril at birth. Story 11. Also not a doctor, but my friend was a 1 in a million case I witnessed. We were in high school at the time, and she had been suffering from chronic back pain for years, but they could not determine the cause. Finally, they discovered that she had a small cyst pressing against her spine, so they planned to drain it with a needle to see if that would relieve the pain. Later, an MRI revealed that her spine-adjacent cyst was actually an ovarian cyst. The anatomically knowledgeable will note that the ovaries are nowhere near the spine, usually. This cyst was near her spine because it was the size of a watermelon. She required major surgery to remove it and missed most of the school year recovering. If I recall correctly, the case was documented in a medical journal due to its rarity. She was an average weight girl with a small abdominal bulge she could not eliminate beforehand. Afterwards, she weighed 10 pounds less and her abdomen was slightly concave. The cyst was so large it displaced her other organs. The situation was extraordinary, but thankfully she made a full recovery, healthier than before. Story 12. Literally saw this with my own eyes. I am an emergency department nurse in Australia. I was in charge this particular evening when I was called to the trauma room. Sitting calmly on the side of the bed was a middle-aged Polynesian man with a broken pool cue through his head. On closer inspection, the tip had gone in through his right eye and pushed his eyeball up, but the eye was still intact. You could feel the tip pressing against the skin in his occipital region, but there was no broken skin. There was not a single drop of blood, and his Glasgow coma scale was 15. The only thing he could not remember was how it actually happened. At the time, I had a spare ambulance crew in the department. They got on the phone to their communications saying there was an imminent transfer to a tertiary hospital. Honestly, all we did was insert an intravenous cannula, gave him a shot of intravenous antibiotics, and bundled him out within about 15 minutes, all the time sitting upright. His surgery took hours because the flattened Q-tip was in danger of clipping a blood vessel as it was being removed in the reverse direction it went in. Every movement needed to be carefully checked. His CT scans from there are apparently legendary. It turns out there is a 1 in a billion way of essentially pushing the brain upwards and missing every vessel. A couple of days in hospital for intravenous antibiotics, and he walked out with no adverse effects to brain or eyesight. Story 13. Obligatory not a doctor. At 3 years old, my child had a total personality change, which for some somewhat justifiable reasons was dismissed by doctors because threenager is a term for a reason. But I knew it was different. I kept saying, no, this isn't that. For the next several years, random symptoms would pop up then go away after several months. I must have taken my child to every specialist within a 500-mile radius. The doctors started treating me like I had Munchausen by proxy. I also felt totally insane because symptoms would go away only for new ones to emerge, like when you bring a car to a mechanic and the engine stops making that sound. I begged for tests and magnetic resonance imaging over and over. I was always told no. Why would I want to expose my child to radiation? Edited to add, magnetic resonance imaging doesn't use radiation, but I was told to get a computed tomography scan first to get to the magnetic resonance imaging. She has had tons of magnetic resonance imaging scans now and will have more for the foreseeable future. By the time they found the brain tumor years later, we had about 13 different psychological diagnoses. All turned out to be inaccurate. Luckily, it was a slow-growing brain tumor and incredibly rare. About 100 people a year receive this diagnosis. In excellent news, St. Jude is the most amazing place ever, and we are through treatment, neurosurgery, proton beam radiation, and a slew of medications, and life expectancy is solid. I cannot possibly say enough good things about St. Jude and our experience in their research program. Moral of the story: never not trust your gut instincts as a parent ever. Story 14. Hydatid cyst located in the brainstem of an 8-year-old child. The parasite itself is rare, and the location is even rarer. Story 15. I am the patient in this story. I went to the hospital for a kidney stone blocking the left side. While there, I developed a kidney stone blocking the right side. Doctors thought I was seeking pills because I kept changing where the pain was, but I insisted on another scan that confirmed I had stones in both kidneys at the same time, and both kidneys were blocked. That is rare, but not unheard of. That night, I had ovarian cysts rupture on both ovaries. The doctors were shocked that someone could have so much bad luck in such a short time frame. Statistics: 9% of women get kidney stones. Of that 9%, only 10% ever experience stones in both kidneys, and a much smaller number have stones in both kidneys simultaneously. About 10% of women will have an ovarian cyst. Of that 10%, about 1% will experience a rupture. 30% of women with cysts have multiple cysts at the same time. There is no available data on how many women have multiple ruptures at once, but it is assumed to be a small number. Someone who can do the math will likely determine how rare my case is. Story 16. Not a doctor, but I shocked the delivery ward. I was 18 and pretty healthy when I got pregnant the first time. I had placenta previa, which is not rare but not ideal. This is where the placenta sits over the cervix, making natural birth nearly impossible. What was shocking was the 6 weeks of bleeding from 23 to 29 weeks, pretty much constantly soaking pads. They couldn't figure out the cause. Then there was a massive bleed that triggered labor at 29 weeks, leading to an emergency cesarean section. I did not see the placenta because I lost nearly 2 liters of blood, but half the hospital did. Apparently, it was very discolored, almost black, and had chunks missing. They sent it away for testing, and I never found out the cause, but I went on to have 2 pretty normal, full-term pregnancies. I did have cholestasis the 3rd time, which is rare but not unheard of. My son survived, perfectly healthy and somehow huge for his gestation at 3 pounds 12 ounces. He turns 10 on Monday. Story 17. Obligatory. I am not a doctor, but my pregnancy with my daughter was high risk. I was 21 weeks and 3 days pregnant with fluid discharge and Braxton Hicks contractions. I ended up going to the emergency room alone after I saw a small amount of blood in the fluid. I was taken to labor and delivery in a wheelchair as a precaution, where they monitored contractions and tested the fluid. It was amniotic fluid, and I was in active labor for hours. They examined my vagina and thought they saw her head in the birth canal. I was told there was nothing they could do, and I would give birth to her naturally since she was too early for intervention. Eventually, an obstetrician-gynecologist and ultrasound technician arrived, and it turned out that the inner layer of the amniotic sac was intact and it was her feet in the canal. I had a 15% placental abruption as well, likely due to the weight pulling down. I asked if there was anything that could be done to save her, and they transferred me to another hospital with a maternal-fetal medicine specialist. I was admitted and put on medications to stop labor. I ended up very lucky because the maternal-fetal medicine doctor was one of the few in the country who would attempt to save the pregnancy. I had an emergency rescue circlage where they washed off the sac, eased it back in, and sewed me shut. I was placed in the progressive nursing unit and was inpatient for 8 weeks, where by some incredible luck I managed to stay pregnant. I was on many medications to stop labor around the clock since I kept having frequent contractions. I was not allowed to sit, stand, use the restroom, or do anything. It was very difficult. I also had a few rounds of steroids for her lungs and magnesium to protect her brain. I was so lucky. Eventually, at exactly 29 weeks, I had an urgent cesarean section because my uterus had an 8-centimeter pericardial window and was about to rupture. It also became increasingly difficult to keep the contractions at bay. She is now 8 years old, very smart, outgoing, and an amazing athlete. I cannot imagine a world without my daughter in it. Over 95% of cases like mine end in fetal and/or maternal death. I was fortunate that the right doctor was there and everything went right just in time. I did have a hysterectomy a couple of years later after it fused to my abdominal wall. It was too dangerous to risk getting pregnant again. I have my son and my daughter and count myself lucky beyond measure. Story 18. A patient presented to the emergency department after a bee sting with a severe reaction. During examination, we discovered a softball-sized tumor on her cervical spine. Without treatment, she would have been quadriplegic within a year. The bee sting truly saved her quality of life. Story 19. Not a doctor, but laboratory personnel. Had a case of a male patient being screened and sequenced for metastatic cancer. Results indicated ovarian primary. You read that right. Male, anatomically male, not transitioned. Males do not have ovaries. The pathologists had us repeat the tests because they thought the lab made a mistake. The result was the same, ovarian primary. It turns out this patient had a liver transplant, and the female donor had undiagnosed ovarian cancer that had metastasized to the liver. The cancer spread aggressively when transplanted into the male patient, who was on immunosuppressant drugs. A medical journal paper was submitted on the case as it was very unusual. One of my most interesting cases to work on. Story 20. Creutzfeldt-Jakob disease almost a decade ago. Nothing we could do. Within 2 weeks of presenting to the emergency department, the patient died. Going back, neurology said the spouse told him the patient was kind and gentle, always joking and sharp until a few months before they showed up to the emergency department. Everything changed, a complete reversal. Very sad. History included one episode of monkey brain ingestion years prior while on vacation. Edit/update. Some people messaged me about symptoms and what I observed. As this is a rare disorder, I do not want to violate any Health Insurance Portability and Accountability Act regulations, so I will be general. 6 to 9 weeks of personality changes. Increased sleepiness. Cussing and swearing with anger from a normally calm and docile parent. The last 4 days before coming to the emergency department consisted of sleeping, yelling, drinking water, not alcohol, then sleeping again. No significant medical problems. Presented to emergency department. Sleeping comfortably in bed, heart rate in the 100s, respiratory rate normal, pulse oximetry normal, blood pressure very high, 221/20 while sleeping. Family sat at bedside crying and whispering. I entered and said, "Hello, I'm doctor." The patient suddenly woke, started yelling nonsense and cussing. Heart rate rose to the 130s. Blood pressure shot even higher. Within 1 minute, he was back to sleep. This pattern repeated whenever we touched him or there was a loud noise near or in his room. Blood work all normal, including thyroid-stimulating hormone, drug screen, and alcohol level. We thought it might be withdrawal from secret drinking, just guessing, so we gave him lorazepam. It did not significantly affect his vital signs but made him sleep more during testing. CT scans with angiography were normal. Lumbar puncture showed slightly elevated opening pressure but was difficult to measure accurately due to patient movement. Otherwise relatively normal. Admitted to the floor with neurology for electroencephalogram. Neurologist called the next day and said this was most likely Creutzfeldt-Jakob disease. Repeated 1 MHz spikes over and over again, almost pathognomonic. We would know more if he decompensated quickly over the next week. The patient went from walking in with family, confused, to intubated within 48 hours, and died in less than 2 weeks. It was devastating for the family. Such a great parent, according to their stories. Very sad. Story 21. I have intractable medication-resistant bilateral temporal lobe epilepsy. My epileptologist attends conferences about my brain occasionally. I wish I were invited. Story 22. Not a doctor or registered nurse. One of my first cases was a woman with a full-body skin disease. Cancer from head to toe. Her hair was gone, her eyelids were gone, and she looked like a burn victim, but it was not burns. It was so severe they had to keep air control on at all times so her skin would stay in the room. It was flaking off and floating around, and her skin was everywhere, in the halls and on clothing. She was miserable and she finally died, which was a blessing. I think she should have been in the burn unit, but who am I to second-guess that? She had some rare skin disease. Story 23. Really wild calf heart on necropsy. This was a couple-week-old beef calf that had a single day of difficulty breathing out in pasture. The farmer gave a dose of antibiotics, but the calf died shortly after. The calf had otherwise been moving with the herd normally and doing normal calf activities. Pneumonia was expected. Instead, on opening the heart, there was essentially just one ventricle. There was a double outflow right ventricle. Both the aorta and the pulmonary trunk were arising from the right ventricle. A common atrioventricular valve connected both the left and right atria to a tiny left ventricle, and there was a ventricular septal defect. The right ventricular wall was very thick and the atria were dilated. For those unfamiliar, the normal mammalian heart has 4 chambers. Blood enters the right atrium, passes through the right atrioventricular valve into the right ventricle, then travels out the pulmonary artery to the lungs, returns to the left atrium, passes through its own left atrioventricular valve into the left ventricle, and exits the aorta. In this case, the blood pathway was right atrium to right ventricle to lungs, back to left atrium, then right ventricle, then body. This is abnormal but apparently sufficient to sustain life for a couple of weeks. A similar cat case with less severe defects. Separate atrioventricular valves that regurgitated less, and a large ventricular septal defect allowing blood to flow back to the right side. Survived to a couple of years old. This heart configuration is somewhat similar to a reptile's heart, which has 3 chambers. Reptile hearts have grooves and structures to separate oxygenated from deoxygenated blood through laminar flow. They also have a much lower metabolic rate and oxygen demand compared to mammals. In this case, it was essentially a cow with a reptile-like heart. Story 24. Backstory. Dad ran a neonatal intensive care unit, very well respected in neonatology. Currently runs it for the state as well as a related charity. As a result, growing up I was there a lot because I had to stay home from school or they couldn't get childcare. All the staff knew me, and on the occasional times there was some media involvement, I got dragged along. It was actually kind of cool going to fancy charity galas and balls as a 19-year-old. Story. Baby born very premature, severe complications, basically dead on arrival. Resuscitation attempted, failed. Dad declared baby dead like, yep, that's done, game over, sorry ma'am. Part of the process with stillbirths or deaths very soon after birth is to give the body to the mother to hold. It's shown to be an important part of the grieving and healing process so that she can get closure. The mother is warned that for quite some time after death, the baby can spasm. It's this weird evolutionary thing where the brain fires off signals trying to revive the body. They're warned because when it happens, a lot of mothers think there's a chance or the baby isn't really dead. But the doctors reassure them that it's just this weird evolutionary thing we never got rid of, like our tailbones. The baby is not alive. The mother is just looking for hope where there is none. So the mother gets the baby, holding it, crying, husband there stoically being a rock for her. She starts freaking out, saying the baby's alive, yelling for help. Staff come by explaining that no, the baby is dead. We told you this. The mother insists. Dad takes a look. That's how I wound up an 8-year-old at a huge press conference beside my dad, who was talking about something that only one other living doctor had ever seen happen. Baby Lazarus, yes, that's what they actually named him, had come back to life because of this weird evolutionary hang-up. Story 25. I am not a doctor, but I have a rare skin condition called linear atrophiderma of Moulin. It appeared one day and looks like a spiraling line of bruises. There are fewer than 50 documented cases of this condition in the medical literature. Story 26. Not a doctor yet, but during my summer break as a medical student, I had to complete a summer practice in my country. I chose to do it in my small-town hospital, not at the hospital affiliated with my university. One evening, the doctor I was with decided to perform a computed tomography scan for a patient, and it turned out he had situs inversus. This condition means all his organs are on the opposite side, liver on the left, heart on the right, etc. Only 1 in 10,000 people presents this condition. Story 27. My father, at 53, had a full aortic dissection ascending type A, the same condition that killed John Ritter. He walked himself into the emergency room with abdominal swelling from blood leaking from his heart and a blood pressure of 43. He underwent 14 hours of open-heart surgery, including a full mechanical valve replacement, and became pacemaker dependent. He turns 60 next month. His sister also died from the same condition at 53. It is miraculous that he lived. Even stranger, 2 siblings had the same condition. He is part of many studies. Story 28. Not a doctor. My friend was recently in the hospital for over a week with high fever, trouble breathing, fatigue, and many unusual symptoms. They suspected influenza, coronavirus disease, pneumonia, bronchitis, and tested for everything, but nothing matched. They then learned he is a landscaper and began evaluating for soil-borne illnesses. Scans suggest he was infected a long time ago, as his lungs appear severely damaged. He works with a crew, but no one else showed symptoms. The likely cause is some type of fungal infection, possibly from animal droppings. They considered histoplasmosis, blastomycosis, hantavirus, or similar conditions but have not confirmed a diagnosis. None of these are common in our area. They planned to continue evaluating him and invited him for free appointments as a test subject. Story 29. I was the doctor's assistant at the time. I worked for an optometrist who mostly did general tasks such as eyeglass prescriptions and pink eye treatment. The most unusual case involved a young man who went swimming in a lake with his contact lenses in. An amoeba became trapped between the contact lens and his eye, burrowing into the inner part of his eye. He came in thinking he had a simple infection, but the diagnosis was serious. We immediately referred him to a specialist in Denver. Story 30. Not a doctor, but my mom was the patient. Starting from 6 weeks old, she has had a wild medical journey. She almost died as a newborn because she had a blockage in her intestines that mostly happens in males, so her doctors almost missed it. She lost a couple of pounds as an infant before they figured out what was wrong and got her into surgery. That started her journey but definitely did not end it. She had cervical cancer in her early 20s, which is not too unusual. She had a hysterectomy after my younger sister was born because the cancer cells kept coming back. She had her gallbladder removed in her early 30s and suffered from chronic headaches, pain, and a weak immune system, partly from having part of her intestines removed as an infant, her whole life. In her 40s, the headaches kept getting worse, and she mostly refused to see a doctor. She also started making rash, out-of-character decisions and began acting differently. It was a difficult time for a couple of years, with her and my dad breaking up and getting back together multiple times. Shortly after my 18th birthday, her headaches became much worse. She could not move, could not stand light, and could barely speak without pain. She was leaking a clear, metallic-tasting fluid from her nose, in her words. We finally convinced her to go to the doctor. It turned out she had contracted bacterial meningitis. She was in the hospital for 2 weeks. While there, after getting magnetic resonance imaging done, they realized she had a tumor in her sinus cavity. She was referred to an ear, nose, and throat specialist, who alarmed us when she looked up my mom's nose, said, "What the hell?" and brought other doctors to look. Apparently, the tumor was visible from her nasal cavity. But that was not all. After further investigation, they realized the tumor had actually started in her brain, ate through her skull into her sinus cavity, and had been growing for years. She had 2 surgeries. The first through her nose to remove the tumor causing her breathing trouble, and the second into her skull to remove all of it and patch the hole in her skull. The fluid she was leaking was cerebral spinal fluid. She got meningitis because of the hole in her skull after suffering a bad sinus infection earlier that year. The tumor in her brain pressed against the region controlling impulse control and decision-making, explaining some of her erratic decisions. They might not have caught the tumor in time to save her if she had not contracted meningitis. She also stopped smoking after having meningitis because of her long hospital stay. After the tumor was sent for testing to see if it was cancerous, they said it was composed of brain-like material and had no explanation for why she got it, but it was not malignant. She is doing well now, more than a decade later. She had seizures for a while after surgery, but a couple of years ago we realized they were triggered by stress and anxiety. After therapy, medication, and a lot of work, she has not had a seizure in over a year, having had them almost daily at first. It is a wild story, one I had not heard before or since. Story 31. I have seen a couple of cases of stiff person syndrome, which has an incidence of around 1 in 1 million, although these people already had their diagnosis, so I cannot claim credit. Story 32. I was the patient, and the actual emergency room doctors missed it twice because I was too young at 22 for a pulmonary embolism. However, I was 6 months postpartum on birth control, had recently had pneumonia, and had a family history of cerebrovascular accident and myocardial infarction related to blood clots. I was very high risk, essentially a deep vein thrombosis waiting to happen. Thank all of the gods for putting a physician assistant who was fresh out of school and eager to prove himself in my path. He convinced the doctor to order a computed tomography scan with contrast, which revealed a clot the size of a golf ball in my left lung. The doctor was ready to discharge me, and I likely would have died if not for that physician assistant who trusted his gut and probably faced criticism from his colleagues until he was proven correct. He knew that something was not adding up to simple pleurisy and saved my life by trusting his instincts. Story 33. A woman presented with a mass in the lower abdomen on scans. She reported having regular menstrual periods. Exploratory surgery was performed, revealing a greatly enlarged uterus. The gynecologist punctured the uterus, and a large amount of thick, chocolate-colored fluid filled the abdominal cavity. This fluid was old menstrual blood under pressure, likely accumulating for many years, possibly since her childbearing age if the condition was congenital. Testing confirmed the fluid was sterile, indicating no infection risk from the spill. However, there was a risk of strictures forming around the intestines and other peritoneal organs. The gynecologist examined the cervix, which was completely closed, making regular menstruation unlikely. It was discovered that the patient had concealed this information out of fear of her husband. One of her complaints was also infertility after prolonged attempts to conceive. This case occurred in a developing country where such issues carry significant social stigma. Story 34. Not a doctor, but I am one in a million, probably less. I was diagnosed with osteogenesis imperfecta as a child, affecting approximately 1 in 15,000 people. I have a mild form, and it has not impacted me much other than blue sclera and frequent fractures. A year ago, during a checkup, I was found to have a 5-centimeter aortic root aneurysm that required immediate surgery. I underwent a valve-sparing repair 1 week later. All is well. It turns out I am one of very few people whose osteogenesis imperfecta presents with Marfan syndrome or vascular Ehlers-Danlos syndrome symptoms, which affect the cardiovascular system. I have been tested to confirm I do not have 2 separate mutations, one causing osteogenesis imperfecta and another causing Marfan syndrome or Ehlers-Danlos syndrome. I do not. Currently, there are only a handful of cases in the medical literature of people with this osteogenesis imperfecta and Ehlers-Danlos overlap syndrome, and even fewer with a recorded aneurysm. Therefore, I believe the odds are much less than 1 in a million. Story 35. I have a male friend who was diagnosed with breast cancer in his early 30s. He became increasingly upset when doctors told him how uncommon it was. Story 36. Not a doctor, but a former legal guardian. In the mid-1990s, I was assigned to a man with acquired immunodeficiency syndrome, end-stage disease, melanomas, and other complications. He was in a hospital at the time, and the doctors gave him 3 months at most. I found a special hospice, an excellent place, and drove him there, which was about 5 hours away. Upon arrival, the director said it was a matter of weeks, maybe a month. The man fully recovered. The guardianship was lifted, and he lived a happy and eventful life for years to come. Story 37. I am not a doctor, but I diagnosed a rare disorder. Starting in his teenage years, my friend began experiencing what he called spells, where his hands and feet would twist in unusual ways. These episodes lasted a few minutes and then went away. Doctors initially told him it was psychosomatic and recommended counseling. I met him several years later when he was in his early 20s. I was in graduate school at the time and had taken a class on neurological disorders. I observed those spells and thought they resembled chorea or athetosis. He eventually saw a neurologist and was diagnosed with a very rare choreathetosis disorder. It was well controlled with seizure medication and resolved in his 30s. Story 38. Not a doctor, my mother was the patient. She had breast cancer that metastasized into her bones. One night she was in immense pain and was taken by ambulance to the emergency room. It turned out the cancer had eaten away a section of her spine, basically disintegrating part of it. She was told that she would likely only survive a few more weeks. Instead, she survived another year and learned to walk again. She was hunched and at least 6 inches shorter because her spine was compressed, but she was able to be mobile, walk, and live a fairly normal life for a while until the cancer spread to her brain. Story 39. I am not a doctor, but my grandmother was the patient. She defied the laws of reality and modern medicine several times. She started dialysis at 79 for kidney failure. After 2 years of dialysis, her kidneys were fine and functioned normally, so they took her off dialysis. That doesn't happen. She lived for another 10 years, and her kidneys were not the cause of her passing. At age 80, she broke her leg near her hip. She was asthmatic and diabetic, and doctors were not optimistic about the risks of anesthesia, but they needed to fix her broken leg. They told us she probably wouldn't walk again. 7 months later, she walked my nephew down the aisle at his wedding without a cane or walker. She managed her diabetes for decades without insulin and ate mostly sugar. She was fine. She contracted COVID-19 at age 87 while still asthmatic. It was a mild case and she recovered flawlessly. Shortly before she died, doctors believed she couldn't swallow and put her on a liquid-only diet. It turned out she just didn't want to eat the hospital food and was pretending convincingly that she could not. Doctors were surprised when they found the two of us happily munching on French fries. Declared infertile after years of trying, she adopted a baby. Suddenly, she couldn't stop getting pregnant. Within 3 years, she went from being infertile to having 4 children under the age of 4. I miss my incredible grandmother every single day. God bless her and her many lives. Story 40. It is nothing glamorous, but as a head and neck surgeon, I frequently encounter various cancers with only a handful of case reports available. Story 41. I'm in that situation. My doctor tried a last-ditch effort to prevent knee replacement surgery, and it worked. He used 3 injections of a facial filler gel to build a cushion to support my kneecap. I have to have it redone every 6 months. I would prefer every 4, but insurance. But it alleviates about 75% of the issues. Insurance had already authorized a replacement, and I was already scheduled for surgery when he decided to try this. When I say last-ditch effort, that's what he calls it. When I told him it worked, his expression was like I told him unicorns and pigs were flying outside. He made me repeat that it worked 3 times before he fully understood. Then he started asking very specific questions, left the room, and brought back 2 physician assistants and another surgeon to ask even more questions. Not exactly 1 in a million, but definitely a very long shot that worked. Story 42. Obligatory. Not a doctor but posting. My significant other developed epiglottitis about 5 years ago. She was diagnosed in the emergency room at a training hospital. It is rare enough that during the week she was in the intensive care unit, the hospital had every doctor, resident, nurse, and medical student they could bring to see her because they might never see another case. My aunt was an emergency room nurse for 30 years, and she never saw a case until my significant other developed it. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.